Hi, I'm Blair Lewis. I'm a gastroenterologist here in New York City, and I think what I want to talk to you about today is colon cancer screening. Colon cancer is the #2 cancer killer in the country. If you actually look at the cause of cancer death, lung cancer is 1, colon's 2, breast is 3, pancreas is 4th, which is a little scary because that's actually increased in incidence, and prostate's 5th. Now, among those cancers, colon cancer is unique because colon cancer is the only one that has a benign and removable precursor called the colon polyp. When you have a colonoscopy, nobody's actually looking for colon cancer. They're actually looking for polyps, these benign growths of tissue that occur in us, and that's where colon cancer comes from. 1 in 4 of us will have a polyp in our life, and if left alone, 1 in 4 polyps will turn to colon cancer in the future. So your chance of getting colon cancer is 1/4 of a quarter, 6%. 6% of Americans get colon cancer. And the idea behind having colonoscopy is that if there is a polyp inside, and polyps do not cause symptoms, you don't wait for blood or pain or change your bowel habits because polyps don't cause any of that stuff. But if polyps are found and they are removed, then they can't turn to colon cancer in the future. And we prevent people from getting colon cancer that way.
So let me ask you a question, Dr. Lewis. Why is it, because this kind of freaks people out about being 50, why is it that they say now at 50? It seems like 50-year-olds, like their happy birthday is, here's your ARP card, here's your cake, and here's your colonoscopy.
Colonoscopy is a coming of age. It's like taking your SATs when you were applying for college. It fits into the same bit as far as I'm concerned. The incidence of colon cancer really starts to rise in the population in the sixth decade of life, when you turn 60. And 50 is chosen as a way of preventing you from getting colon cancer because we're looking not for cancer, as I said, we're looking for colon polyps. So that incidence continues as long as you live. There are some people out there that are going to be older than 50, and they think like, oh, it hasn't come to me, and it's not going to get me. The incidence of colon cancer continues as long as you're on the planet, and when you turn 60, that incidence starts to rise. The other thing that people have, this concept is that, oh, it's not in my family. Well, 70% of colon cancers have no family history. So you can't base it on the fact that nobody in your family has colon cancer. Everybody needs to get checked.
How often do people need to get checked if they have, okay, you get your first one at 50.
Yeah, that's...
And then what's kind of, it's not like a mammogram where you do it every year.
Right,
what's the routine?
Now there's a little bit of a debate there, and it's really done on cost-benefit analyses. So you'll see a couple different numbers in the literature. You go to the web and you research this. There's a national Medicare, American Cancer Society number of once every 10 years. That number is based on cost-benefit analysis, that if you have colonoscopies every 10 years, if every American did it, we would reduce colon cancer deaths by 80%. Pretty phenomenal. There's a 5-year number out there that says that if you come every 5 years, we reduce colon cancer deaths by 95%. Of course, that would be twice as many colonoscopies to get a 15% kick. So that's why there's a federal number of 10 years out there.
But 95%. So
Right.
you would really almost eradicate colon cancer altogether if
right. And it would never become a 100% because there are nuances to the exam where people may miss things, or the prep may not be good, or the exam may be incomplete, and nothing's perfect. But if everybody came every 5 years, you could actually almost eradicate this disease.
Now, at the moment, how many Americans actually go in and get their colonoscopies?
We're doing better. We're certainly doing much better. It's estimated that 12 million Americans are supposed to be checked every year, and right now it's somewhere between 5 and 6 million are. We're almost to the 50% mark. We're not quite to the 50% mark. We do better here in New York than other places in the country. East Coast, West Coast tends to lead the way, but still there are a lot of people who do not get checked. It's interesting because they've looked at why people, and maybe I'm looking at some people right now that have never had their colonoscopy, why people don't get checked, and you would think that maybe they're embarrassed about the exam, or they think that the prep is going to be horrible, they've heard bad stories of the rest, or it's going to be painful. It's none of those things nowadays. I mean, but the key factor in the country is that most primary care physicians don't recommend it. And so we're really trying on a national level to get primary care physicians to make sure their patients do have their colonoscopy, push their patients to be checked.
Why don't they recommend it?
I think it's sort of old school, old experience. They have knowledge of way maybe colonoscopy was back in the 1970s at the start of this whole thing. Instruments are thinner now, they're high def, they're digital instruments, the quality of the sedation is much better, preps have gotten so much better. I mean, it used to be people would drink either 4 liters of horribleness. Everybody's seen Katie Couric's bit on TV trying to drink 4 liters at home. Most preps now are 2 liters, they taste good, it's complete at home. I mean, there's a variety of things that are on the market. You talk to your doctor, but it's not as onerous a task as it used to be.
I will vouch for. I mean, I had mine with you at 49, and it was like everyone tries to freak you out, and it was like the easiest thing ever. Let me ask. I'm finding more and more as I interview doctors such as yourself who are at the forefront of their practice that so many of these primary care physicians are not telling people to go get, let's say, like CT scans like we heard about yesterday. I mean, mammograms have really gotten their publicity. Can you give me some advice, give the people listening some advice. How can you go about, because you have to be really proactive, it seems, with your work. What do you go in there and say? You sit down with your doctor, you're 50 years old, they just kind of give you the once over and go, see you whenever. What can people do to take control of their own medical health?
You do actually have to take control of you. I mean, you own your body, you take care of your body, you live in your body. It's up to you to make sure that you get the right health care that you need. And it's not that your doctor's bad, it's that he's a human being like you are, and you don't want to necessarily have a colonoscopy. He thinks about himself or herself having a colonoscopy, they're not too keen about that either. So that'll come across in the conversation. But so it's really up to you. You know, you're on net now, you're watching this blog, you sort of are attuned to these things. You will find if you talk to a physician that it's not what you think it is. I mean, preconceived notions are the thing that hampers us, every aspect of our lives. I can tell you stories about my life where I had a preconceived notion about something to fix at home that turned out to be true, and you have a preconceived notion about what colonoscopy is like that I can promise you is just not true. It's just not a big deal in the end, and it's a test that can really save your life.
So just go in there and tell your doctor, I'm at 50 years old, can you please give me someone? Recommend.
Right. And we were talking before the camera came on that typically what happens is that physicians may tell their patients to have a colonoscopy and may give them a name, but in the end, people go home, they talk to their friends, their neighbors, their relatives, and most of these things are done as patient-to-person referrals, and so that's a lot of what my business is built on. It's just as patient referrals. And that's, you're going to find somebody in your community that has a great reputation, that is able to do your exam, and make it really a non-event. That's the key.
So what you really would say is, at 50, get your first.
Right. And I personally would say that at 55, think about doing it every 5 years. I think you'll see that the one at 50 is not a big deal, and so every 5 years to do something is really not such an onerous task. Right?
And it'll save your life.
And it will definitely save your life. There's no question. I mean, when somebody, it's such a common cancer, 6%, that means that all of us probably know somebody who has had and may probably has died of colon cancer. It's just it's so common. And when somebody gets colon cancer nowadays, I mean, from my perspective, it just breaks my heart, because you think, man, if that person had a colonoscopy a long time ago, not a year before or whatever, but several years before, we could have prevented all of this suffering in this person, and it just definitely breaks your heart.
Well, thank you, Dr. Lewis. You're a wonderful doctor. You give a great colonoscopy. And I actually can't wait for my next one, which is in 3 years.
There you go.
Okay. Thank you for sharing your wisdom with us today.